Hi, everyone. I'm Emily Kennedy, health coach and fertility educator at Reply OBGYN and Fertility. We recently shared a post about vitamin C and its role in the immune system and fighting stress. And as a follow-up question, we got a question about the role of vitamin D and how it might relate to COVID-19. So I'm going to address that in this video today. But just to backtrack a little bit, what exactly is vitamin D? Well, it's a fat-soluble vitamin that's found in some foods, but is mostly produced when UV rays initiate the synthesis in our skin. And it is scarce in foods. I'm going to list those food sources later on. So supplements are often recommended, especially in the winter months when you don't see the sun very much. So why is vitamin D important for our health? Well, it's important for a lot of reasons. It's widely accepted that it's important for bone health, prevention of osteoporosis and a condition called osteomalacia. It's important for brain health. It's important for the reduction of inflammation and the health of our immune system and cellular growth. And the role that it plays in all these functions is in concert with other nutrients. It just helps for all the nutrients to work together to keep your body systems functioning smoothly. There's also some research to say that vitamin D may be helpful in improving conditions like high blood pressure, certain types of cancer, heart disease, depression, and yes, maybe even some types of respiratory illnesses. In terms of fertility, adequate vitamin D during pregnancy also appears to reduce the chances of having a low birth weight baby, and low levels of this nutrient may have implications for fertility. But it's important to note that most of the effects of vitamin D have not been studied in controlled settings. And so studies need to continue to look at the benefits of vitamin D on various conditions. There needs to be ongoing research, basically. So you might be asking now, how do you know if you're doing okay for vitamin D? And it's true. Deficiency is fairly common and it's on the rise. Partly due to our vigilance in protecting our skin from the sun, and partly because, hey, we're in this stay-at-home time and some of us may be spending too much time indoors. Actually, I heard that the average American spends less than 15 minutes outside, and that was before COVID-19. The best way to know if you're doing okay is to have your healthcare provider do a blood test. And so what you're looking for in that blood test is a concentration of 20 to 50 nanograms per milliliter, and that's considered adequate. 20 nanograms per milliliter is established as the minimum adequacy for bone health, while blood levels above 50 might actually be associated with adverse effects. So you can be too high. Keep in mind, though, the exact relationship between blood levels and risk of certain health conditions still needs to be explored in ongoing research. So now you might be thinking, hey, that's great information. How can I make sure that I'm getting a steady intake of vitamin D? And I put intake in quotes because, like I said, food sources of vitamin D are fairly scarce. In the realm of vitamins, it's definitely not as widely available as say, like vitamin C or vitamin B. One of the top food sources, if you will, is actually cod liver oil, shown here in the supplement. And I'm not endorsing any particular brand, but cod liver oil tops the charts as a food source and can give you up to 1,200 international units or IUs per tablespoon. And then in terms of foods you can actually plate up for dinner, fatty fish like salmon or trout, just 3 ounces can provide up to 600 IUs, especially if you eat the skin with the fish with the skin. So some people might not like that, but a lot of the vitamin D is directly under the skin of the fish. So 3 ounces, that's about half your palm. Another fun food source is actually your typical white button mushroom. So I got one of them here. And here's a fun fact, is that mushrooms can actually increase in a specific type of vitamin D when their gills are exposed to UV light. And so you can get up to 300 international units if you sun your mushrooms gill side up and, eat about a half cup of them. Just put them in a stir fry, however you like to enjoy your mushrooms. Other food sources that give you about 40 IUs, which is not a heck of a lot, but the egg yolks, beef liver, canned tuna, 3 ounces of all those foods give you about 40 IUs of vitamin D. And of course, there's also fortified foods such as milk and some boxed cereal. But vitamin D is called the sunshine vitamin for a very good reason. And that's because even small amounts of sun exposure can go a long way. So this makes up for the food scarcity. Did you know that the vitamin D in your skin, when your skin produces it, can last twice as long as the vitamin D that you take through foods or supplements? During our beautiful spring, if we actually get a consistently sunny day, try to get out there and expose at least 60% of your bare skin, no sunscreen, for at least 15 to 30 minutes during the mid-peak level of sun, which is between 10 a.m. and 12 noon, if it's not cloudy or rainy, of course. Keep in mind that darker skin tones require more time in the sun to make the same amount of vitamin D as a fairer skinned person would. So what is vitamin D supplementation used for? Well, actually, very high levels of vitamin D have been used for alternative management of immune diseases like multiple sclerosis. And of course, it can be used to treat vitamin D deficiency, which is blood levels below 20 nanograms per milliliter. So getting back to the question, in short, we cannot yet directly link vitamin D deficiency to your risk of contracting coronavirus or any other illness. Although there is good evidence to support that obtaining adequate amounts of vitamin D can help optimize your bone health, brain health, immunity, and even help reduce inflammation. Our reply clinicians typically recommend at least 1,000 to 2,000 IUs daily, or an amount that is appropriate for your personal needs as determined by your healthcare provider. Personal needs vary with age, personal health history, family history, stress level, and even body composition. So again, as a health coach, I'm here to help you. What am I here to help you with? I'm here to help you make 100% doable lifestyle changes on meaningful health goals, like making sure you're getting enough vitamin D. Meaningful goals are goals that you believe will help you feel healthier. And they can be anything from just getting started with a new habit that you've been thinking about for a while, to something like getting better sleep, quitting that emotional eating, or even hitting the recommended 150 minutes a day of physical activity. Anyhow, That's health coaching for you. If I've piqued your interest and you're interested in learning more, there's lots of ways to get in touch with us. You can give us a call at 919-230-2100. You can send us a message on the Reply Patient portal or a message on the Reply Health app, which is now available on iPhone. Or you can visit the youaskwereply.com website, just like the lady who prompted this video. So, hey guys, keep those questions coming. Thanks so much for taking the time to learn about vitamin C. I had lots of fun sharing what I know, and I hope you enjoyed it too. Bye for now.